Steve, could you put the same seating of the council?
Oh, what's up?
Yeah, these are
Well,
That's why. All right, you're all good.
Thanks. Thank you. Good afternoon. Today is Friday, the 26th of June, 2020. It is 3:08 p.m. I'll call this emergency special call meeting of the Lubbock City Council to order. Thank you for being here this afternoon. We're joined by Councilwoman Latrell Joy via telephone this afternoon. Ms. Joy, can you hear me? You're on Zoom. Good afternoon. It's good to hear from you. The first item on our agenda is a posted executive session. We will not go to executive session right now. We certainly reserve the right to do that at any point before the end of our meeting today. We'll move now to citizen comments. It's item 2 on our agenda. According to Lubbock City Council rules, any citizen wishing to appear before a meeting of the council regarding any matter posted on that council agenda may complete the sign-up form provided at the meeting and do so before the meeting begins. We've got a couple citizens who have signed up to speak. Just a couple more reminders regarding the guidelines on that. You can when you come up, we want you to read your name or state your name and address for the record, and please limit your comments to 3 minutes. You will get a warning when you have 30 seconds left in that 3-minute time period. I will begin by inviting Ashley Johnson to come forward and speak. Ms. Johnson, hold on one moment. Let me get your microphone on. There we go. You're live. Thank you.
Hi, my name is Ashley Johnson. I live at 5710 Second Place Drive. Do I begin now? All right. Well, it's a pleasure to be here. I just wish it was under different circumstances. First of all, I am against the mandatory masks. Just like Roe versus Wade, it's my body and my choice to wear a mask. No one's fears should ever interfere with my personal rights and freedoms. So I ask, where does your elected position give you the right to pass legislation? We are the American people that elected you to enforce the current laws and statutes, not to make your own laws. To me, this is a dictatorship. You have overstepped your elected authority, and patriots will stand against you and your unlawful fines. I want to know where mandated masks are for the flu A, which is also H1N1, flu B, strep, or colds. Each of these has an equal or higher infection rate. I want to point out the actual science and data on the COVID-19 that people seem to not know or refuse to acknowledge. The CDC has downgraded COVID-19 to that of the flu. I quote, no longer considers COVID-19 to be a high consequence infectious disease, end quote. In fact, the Advisory Committee of Dangerous Pathogens is also, and I quote, of the opinion that COVID-19 is no longer classified as a highly contagious infectious disease. Also per the CDC, COVID has a fatality rate of 0.26%. Why are we mandating masks for a 99.74% survival rate? Are you going to do this every year? Or are we only going to do this until the depopulation specialist, Bill Gates, comes up with a vaccine? Or even better, will you follow Oregon's Democratic Governor Kate Brown and require masks for all non-blacks? The city of Lubbock has 261,000 residents. Lubbock County has 305,000, and our death toll since this began is 51. So I conclude, Abbott told Daily News that, and I quote, "Authorities could not punish individuals for keeping their faces covered," end quote. So please tell me how you can enforce this policy. As you destroy our human rights, I reiterate, it is my body and my choice. Thank you.
Thank you very much. Next to speak is Russell Peck. Good evening.
Thank you, Council. I'm not the healthiest person alive. I
Mr.
have
Peck,
two
if you,
children.
Mr. Peck, if you name
Sorry.
name and address,
My name
please,
is
sir.
Russell Peck.
For the record, thank you.
My address is 5005 54th Street.
Thank you.
I'm not the healthiest person alive. I have two young children. If, for some reason, I did catch this disease, it is entirely possible that I would not make it. I do understand there are people who have their individual rights. This is not one of those times to fight against a mild inconvenience that saves lives. Council, I charge you with Rule 303. You have the means. You have the responsibility to act. Thank you.
Thank you, sir. Appreciate you being here. Okay, I believe that, Mr. Goodwin, that's all that signed up. Is that correct? Dr. Cook's going to speak later as part of the item itself. Okay. So I'll conclude citizen comments and move to item 3. This is an item regarding the possibility of the mayor issuing a declaration disaster regarding large gatherings and the requirement for face coverings. Before we have a moment to discuss that order, I thought we might go to the city manager and ask him to catch us up on what's become an ever-changing state emergency order situation. I believe we've had I think this morning, the fourth, just this week. Does that sound right to you? Fourth change, at least the fourth change?
I believe the third change this week,
Okay.
plus some clarifying information.
Okay, all right. So if you would please take a moment to update us on that. I think I think both us and citizens would appreciate hearing that. Okay.
Certainly, Mayor. Glad
Thank
to
you.
do that.
Thank you.
Did you wish to see the most current data slides?
I think anything that you feel like right now would be appropriate for this discussion, I think would be appropriate. And
Thank you.
I will go to your click share.
So Mayor, City Council, members of the audience, just going to show you 2 slides today. The slide before you right now is the cumulative COVID cases in Lubbock County, and they go back to March the 17th. So this is our entire history, if you wish to look at it that way. The lower of those 2 red arrows is on the 17th of June. Of course, today is the 26th of June. The slide ends on the 25th. We don't have today's numbers. That upper red is at 1,800. What you see here is in a 10-day run, a doubling of the total cases. A doubling of the total cases. In a 14-day period, we have broken your positive cases down by more discrete age groups. We typically report in 10-year blocks. This one, we did notice something a bit different as we begin to spike up. And you can see where this is hitting, and it's hitting the hardest, and it's the 18 to 24-year-old group, obviously, and then moving second into the 25 to the 29-year-old age group. Had you looked at this chart anywhere more than about 2 weeks past, all of these bars would have been shifted much farther to the right. You were seeing the impact on the older breakdowns, and that's not where we're seeing it today. So would suggest to you, besides your case count doubling, the big thing that is hitting you is what's called the positivity rate. That is the number of cases tested per day that come back positive. Your long-term average for that in Lubbock is less than 3.5%. Your 7-day rolling average is now over 10%. So it's nearly tripled. And it's done that in a short period of time. That's not on this chart. That's something to talk through. Mayor, with that, we can leave that up, and I'll jump into the order however you would choose.
That'll be fine.
Okay, so this morning, 8:45 a.m. is the official time. Governor Abbott issued what is known as GA 28. This now is the most recent executive order in response to the pandemic in the state of Texas. If you have those with you or if you have those on your screens, I'll start on page 2, and I'm going to highlight primarily the changes that were made. So first, and it's in the now therefore I category, the changes that are contained within GA 28 are effective at noon today. So they've now been in place for 3 hours. There is one exception, and I'll show you that when we get to it in its order. So just recall noon today. Going to page 3 of the order, number 5. This is
Mr. Atkinson, hold on one moment. I'm going to make sure that all the council has that document. Looks like Mr. Chidis has his.
Mayor, Council, it might be easiest. That was distributed by email as it came out from the state this morning. I apologize. I did not make separate copies.
Okay. All right. Give us a moment. Give us a moment. You have it, Ms. Joy? Yes. Okay. Give us a moment. Give the rest of us a moment to pull it up on. Okay. I did too. I just want to give everybody a chance to pull it up on their iPad. Okay. Why don't you go ahead and get started.
Okay, thank you, sir. So again, this order, the changes in the order are effective at noon today, with one exception, and we'll cover that exception here in just a moment. If you would go to page 3 of the order, if you're following along, number 5. Mayor, this was subject to an earlier change by Governor Abbott this week, but it has now changed again, so I'm going to read it as is and highlight a few of the pieces. For any outdoor gathering in excess of 100 people, other than those listed in paragraphs 1, 2, or 4, the gathering is prohibited unless the mayor of the city in which the gathering is held, or the county judge, if it's in the unincorporated area, approves of the gathering. So we start out with a presumption that an outdoor gathering of 100 or more people is prohibited, and it remains prohibited unless the mayor grants approval, and such approval can be made subject to certain conditions or restrictions not inconsistent with this executive order. This is a much stronger statement. When this was re-released on Tuesday of this week, the change Tuesday was to go from gatherings of 500 or more and take it to 100, but it was permissive. It said a mayor or a governor may impose restrictions. Now it says unless the mayor or the judge does do so, that gathering is prohibited. So it's been out today. We've had lots of calls where people say that every one of these gatherings is now over. It is not. but those gatherings are subject to the approval of the mayor or the county judge. The next paragraph, number 6, this has a change in it. For a dine-in service by a restaurant that has less than 51% of their gross receipts from the sale of alcoholic beverages. 51% is only magic because in state law, that is the differentiation between a restaurant that serves alcohol and a bar. We commonly use them interchangeably, and many times they appear interchangeable, but they are not. So this refers to a restaurant that is licensed as a restaurant, not a bar. Today, and yesterday, and the day before, they operated at 75% occupancy. They will continue to operate at 75% occupancy until Monday. So this is the one that didn't go into effect today. On Monday, such restaurants may only operate at up to 50% of total occupancy. So this will pull itself down starting on Monday. Number 7, people shall not visit bars or similar establishments that hold a permit from the Texas Alcoholic Beverage Commission and are not restaurants. So we're back to the 51%. And often you see these establishments have a big red 51% that are on their doors. These establishments can still do, subject to their other regulations, drive-through, pickup, delivery, etc. People shall not visit. So this went into effect at noon today, and you've seen it referred to as the bars are closed. They are closed for in-person visits. All right? I'll highlight number 8 just because it's ironic since we're in Lubbock, Texas. Number 8 says we will not have any commercial rafting or tubing services. So I think we know what parts of the state that might be targeted at. Mayor, I'm pleased to report to you the city does not operate commercial rafting or tubing services. Moving down, I want to highlight next 2 items that did not change in this order and that have been in the governor's orders really since this began. The first, on number 12, says that people should not be in groups larger than 10 and should maintain 6 feet of social distancing from those not in their group. That's not new. The governor chose to continue it. Number 13, people over the age of 65 are strongly encouraged to stay at home as much as possible, to maintain appropriate distance from any member of the household who has been out of the residence in the prior 14 days, and if leaving the home, implement social distancing and practice good hygiene. That hasn't changed. I think it's good advice. Let me go now to number 15. This is also a carryover. It's relevant for your discussion today. Nothing in this executive order or in the DSHS, Department of State Health Service, nothing in the order or the DSHS minimum standards precludes requiring a customer to follow additional hygiene measures when obtaining service. Individuals are encouraged to wear appropriate face covering, but no jurisdiction can impose a civil or a criminal penalty for failure to wear a face covering. One speaks to what a business does, one speaks to what the government does. Mayor, Council, with that, would suggest to you that those are the operative and relevant changes today, plus a few of the carryover items that I feel may assist your discussion. I'll be pleased to answer any questions or yield the floor.
Okay, Council, any questions for Mr. Atkinson? Ms. Joy, you good with that?
I have a question about number 15. It says nothing in this order precludes requiring a customer to follow. Is that something that the city can do, or is it addressed to the business? Or both?
I'll start. Mr. Weaver and his staff may want to help a little bit for me, but certainly the city has customers and the city can require that. I think that's clear. Can the city work with a business in order for a business to require that? I believe that to also be the case, and in fact appears to be the operative part of what you've seen in many of the prior county orders that have been discussed. Mr. Weaver?
I think that's largely true.
Will you hit your button, Mr. Weaver?
Sorry. I think that's largely true.
Hold on a second. I'm having a hard time getting you on. Okay. Go ahead, Mr. Weaver.
I think that's largely true. I think additional requirements could be in place. Additional hygiene measures could be in place.
Did you hear that, Ms. Joy?
No,
Mr. Weaver said that he said that he feels like that's largely true, that additional measures could be put in place.
by the city.
Say again, I'm sorry?
Additional, could be put in place by the city
Or a business,
or business.
yes. Other questions? Mr. Chavez?
Thank you, Mayor. Just on number 15, Mr. Atkinson, where it says jurisdiction can impose, will not impose any penalties. So what we're actually doing, we are strongly advising, we are strongly recommending, if I interpret this correctly.
You will consider later today an order,
Okay.
and it carries the force of order. However, because of this one unique item as it relates only to the facial coverings, you do not, as the City Council, have the ability to impose a civil or a criminal penalty if someone does not.
Understood. Just wanted to clarify that, because that seems to be the question the public has out there.
And it's a good question.
Thank you. Thank you, Mayor.
Thank you, Mr. Chavez. Mr. Christian?
As a follow-up to Mr. Chada's question, how does that apply to businesses? As far as the criminal or civil, we know that that can be happen, but there can be some other punitive measures for businesses other than, we know bars, TBABC, but is there anything that if other businesses don't follow and do face coverings, is there any penalties that would apply to them?
There are counties, and there may be 2 cities. I have not read every one of the orders, but there are definitely counties, and they seem to be split about 50-50, that have indicated they have the authority not to impose a fine only, a fine on an individual, but rather on a business. So Bexar County was the first order that really kind of got out. That was the one the governor spoke to that he said was okay. That one has no fine established ever in either side of its order to an individual, but rather it holds out the ability to do such to a business, and it's based on what's called a health and safety policy. The county said, you'll create a health and safety policy, and at a minimum, it will include facial coverings for an employee and for a customer. Employee and customer. The later language, and I have it if it needs to be read, the later language speaks to any potential penalty, fine going to the business.
Mr. Christian, you'll see in a moment in the order that I'm suggesting that there would not be a penalty for individuals or businesses.
I was just thinking there was another city.
Yes, sir. That's correct. Thank you. Okay. Let's shift to Mr. Massengale. In your role as co-chairman of the Lubbock Economic Recovery Task Force, your full committee met on Wednesday afternoon. Would you summarize that meeting and share any recommendations from that group with our council?
Certainly, Mayor. So the Lubbock Economic Recovery Task Force met Wednesday. is a meeting called the week prior, primarily to discuss communications. Our group had already started working on how to change the messaging on the importance of facial coverings. Prior to that meeting on Wednesday, our city council meeting, our council discussed many things, including the merits of facial coverings and any ordinance related to that. Council desired, since that was a group that was designed to advise the council on anything related to fighting the coronavirus, they wanted to hear from that group. So we really had two things on our agenda, and we spent the better part of an hour and a half discussing the merits of an ordinance, or an order rather, emergency order, to require facial coverings in businesses. The consensus of that group was to recommend an order for facial coverings in businesses to this council. Mayor, today we have 3 members of our recovery task force that would be willing to make a few comments related to that.
I think that's appropriate. Mr. Messingill, why don't you call them up if you would, please?
Okay, I've got Barry Orr, Eddie McBride, and Dr. Joshua Hill here, and I'll start with Mr. Orr, if you don't mind.
Thank you, Steve, Mayor, council members. I speak to you today. My name is Barry Orr. My business address is 9816 Slide Road, Lubbock, Texas. But I speak to you today both as a member of the task force, but also as a CEO of a company with 140 employees, and today have 3 COVID diagnoses in our company. So I speak to you from that vantage point. The Alert Task Force met Wednesday to discuss the options available to us to slow down the progression of the coronavirus in our community. And it was a consensus, 100% consensus of the task force that an ordinance for wearing a mask is in order. As a city, we've tried to stay ahead of the curve, both in safety, protocol, everything we could to limit the spread of the virus, but frankly, we're losing ground. As a community, we're going to have to run faster, work harder, work smarter to keep our businesses open and to keep the strain off of our medical facilities. We need to use every tool available to us. Wearing masks in public is not an end-all solution, but it is proven that wearing masks slows the spread. And the truth of the matter is, it is virtually the only tool we have left to control this spread. The decision will not be popular with everyone, but we each must be socially responsible and wear masks for the good of this community, and above all, to continue to keep our businesses open. Thank you.
Thanks, Barry. Dr. Hill?
Mr. Massingill, Mr. Mayor, Council, thank you for having me. It's been an honor and a privilege to serve on the Alert Task Force, as well as serve the Lubbock community as a family medicine physician throughout this pandemic. These are trying times for everyone in the city, everyone in our state, and everyone in our country. There's so much confusion and twists and turns, as Mr. Atkinson can attest to, with the direction from our leaders and the governor's office. And that's the same type of confusion that Dr. Cook and I face in the community, in the medical community, every single day. The one thing throughout this whole ordeal that has remained steady is that if you can reduce the transmission of this virus, you can turn the corner and start winning the fight. And one may ask, how do you reduce the transmission of the virus? And that is simply by social distancing, avoiding large crowds, and when you are not able to do that, such as in a business or in a setting like this where you're in close proximity with folks that don't live in your household, that is to wear a facial covering. Those are the facts, plain and simple. We can debate on the severity of this illness and the severity of this illness within certain segments of our population, young, old, sick, well. But at this time, I believe, as a citizen of Lubbock, Texas, and as a member of the medical community, that we need to put those arguments aside and do what's better for our community. And the best way that we know how to protect our community right now is to reduce transmission. And that's why, along with Mr. Orr, Mr. McBride, and the rest of our task force members, regardless of if we liked the idea or not, it was pretty well understood that we needed to require or strongly recommend or try to best enforce any way that we can facial covering and social distancing. And again, thank you so much for your time and your consideration.
Thank you, Dr. Hill. Mr. McBride?
Mayor and council, thank you all very much for the opportunity, and I want to echo both what Dr. Hill and Mr. Orr has already said about the conduct and the quality as well as the quantity of time that was given on the task force. Councilman Massengale, you and Robert Taylor did a wonderful job at chairing it and running it. I appreciate Councilwoman Joy, her input the entire time, and I cannot speak on behalf of Dave Marcinkowski, but his role in this was pretty instrumental and as well. So I think all in all, of all the opportunities I've had a chance to serve on any committee, I think this particular committee in these particular trying times has done an outstanding job. So I want to congratulate the City Council on that end of it, is making sure you had the right people on that particular committee. And I served as an advisor, so I got to listen a lot more and I got a chance to speak. So one of the things I can honestly say is that I completely have faith and confidence in what that committee came up with. And on behalf of the business community and the Chamber of Commerce members that I represent, I'd like to pose this following statement. The more we follow these guidelines that we are about to see, the safer our city will be, and we can open sooner the city of Lubbock for business. With this increase in community spread, businesses and employers must take more precautions to protect their employees and their customers. If we can't do a better job of this, we can't expect to fully open. So obviously we've got to do this together, and whether or not we agree about masks or social distancing, let's follow these new guidelines and flatten the curve. We've seen what the impact it has been on businesses throughout the course of this, and individuals in this community who have been severely impacted by this. And so that's where, from the business community's perspective, we all talk to hundreds and hundreds of business people on a day-to-day basis, and I can tell you not all of them will agree. But when it comes to protecting not only their employees, but to customers, this is the best choice, and I suggest that obviously we follow this path. So thank you all very much for the opportunity to speak.
Thank you. Mayor.
Thank you, Mr. Orr, Dr. Hill, Mr. McBride. Council, before we, I want to hear from the Public Health Authority, but before we do that, I know that Ms. Joy and Mr. Massengale have been part alert, but do other council members have questions for any one of the folks that we just heard from? Mr. Christian?
I would just like to ask Dr. Hill if he could enlighten us on some personal experiences he's had with any COVID patients, or has he had any?
Dr. Hill, would you please come back up, please, sir? Thank you.
Just kind of a, we all hear about people that have contracted COVID-19, and we hear some of, vague stories, but if you could give us just kind of a overview of what happens when somebody contracts COVID and hopefully they recover from it, and the treatment. I'd just be interested in your perspective as a physician.
I think that's a great question, and that question is one of the reasons why it leads to many more questions. This virus, for one, is very, very real. It is easily transmitted, and once you get the virus, there is a wide spectrum of disease and severity of disease, and it's followed the pattern of some of the viruses that we've encountered and some infections that we deal with on a day-to-day basis. I've had young patients that get diagnosed with this, and the only reason they know that they have, only reason they came to get tested or found out that they had the coronavirus is they were exposed to it or they were around to someone that was exposed to it. I've had patients that you would consider young and otherwise healthy that were flat knocked on their back. Now, did they require hospitalization? No, but they lost man hours at work, which cost their business and themselves financial gain. And as we well know, I've had a number of older patients, whether sick or well, that whenever they contracted this virus, ultimately were severe enough to where they had to be hospitalized. Now, fortunately, I haven't had any fatalities, and thank goodness for that, and thank goodness for the support of the folks in our medical staff at Covenant and in the hospitals at UMC that are taking care of these folks. The severity of illness is so broad. The only thing that we know definitively in the medical community is that this is real, this is easily transmitted, and it has the potential to be fatal. And whenever I say fatal, it can be quickly. Patients feel well, develop a fever, develop respiratory distress, and may end up on a ventilator within hours. And some people don't. And that's scary in my field. Messing with something that you don't know, that's the biggest fear that we have. Thank you.
Thank you, Dr. Hill. Mr. Chattis, do you have a question for
Yes,
Dr.
Mr. Hill.
Dr. Hill?
You're not getting away that easy. Just thank you for the service you got, the time you've dedicated to this. I'm part of the target audience that everybody refers to, over 65. So I'm very cautious. I wear my facial covering every chance that I get. Long term, well, first let me back off. Let me back up a little bit. I've heard the phrase, it's just the flu. Well, how do you respond to that?
That's not true.
Can you give us I know the flu is just a couple, 2 or 3 days you're over it, or you get a vaccine to help out.
Well, the flu is a virus just like the coronavirus is. They're both very easily transmitted. They're both typically transmitted through respiratory droplets, and they both cause their most damage by causing infections in the lung. The flu has been around for centuries, and we know how it's transmitted, how it incubates. We have a vaccine that is relatively effective, year to year. We have effective treatments for the flu whenever you contract that virus. None of that can be said for the coronavirus. And, the flu, I do not want to take anything away from the flu. It is a very deadly virus. The flu every year kills more people than people that die in car accidents. The coronavirus has ravaged our community, our state, our country like, we haven't seen in centuries. So I don't think it's fair to compare the two, and I do not think they're the same.
One more question. Long-term effects of, after you recover from COVID, can you give us some information on that? Is it that whatever is available?
Again, it's highly variable. Some folks get the virus, whether they become sick or not, their body's able to handle it, they recover, and they go back to how they were before or gradually get there. Some folks don't. Some people are not able to clear the virus in the time frame that we would expect them to clear it and therefore stay positive for longer periods of time. Some folks, because of the initial injury, have, end organ damage that may or may not recover with time. It's too new for us to know, to give you a hard and fast answer, but that's the best I can answer it at this time.
Thank you, Dr. Hill. Thank you, Mayor.
Thank you, Mr. Chattis. Thank you, Dr. Hill. Okay.
Mayor,
Yes, ma'am. Ms. Joy,
I have a comment,
please.
if you'll allow me. I think that the governor made a clear statement when he entered his order on Tuesday. his recent order, basically closing the bar. And he did that based on statistics, not on, gee, I think that would be good. It was on our numbers. And because he made that statement, it causes me concern that if we do not protect our businesses, that could happen again. He could back that order up and close, and we do not want that to happen. They've endured enough. He backed up the occupancy for restaurants from 75% to 50%. So we have to do a better job, because I don't think there's any question that if the statistics supported, he would be willing to make some further, what I would call draconian orders. And I question myself when he entered the order of closing cars, and would that change my view of what our task force recommended? It does not, because those bars will reopen. We don't know when, but they will. And so we need to do everything we can do between now and then, and after they open, to protect not only our businesses, but our citizens.
Thank you, Ms. Joy. Mr. Atkinson, I want to invite Dr. Cook to come up in a moment, but I think it's important that you spend a moment and explain what the public health authority is, what the state of Texas law provides for in that role. Then we'd like to hear Dr. Cook's thoughts on a mask requirement. Mr. Atkinson.
Thank you, Mayor. It'd be a pleasure to do that, and I want to start certainly by thanking Dr. Cook for what he's done for the community, for the city. He's actually done this for us for a long time, but I think since the beginning of March, you've seen truly the importance of why the health authorities are enabled to do what they do, and certainly Dr. Cook's skill in doing so. So in essence, in state law, we and/or the county, or in the absence of that, the state of Texas itself, requires you to have a public health authority. Public health authority is a medical professional. Generally, they do this for us on a part-time contract basis. They have other business that they do. But what they have as it relates to their job here, to their job as a public health authority, is really a very large and unique responsibility. And that responsibility is to provide the guidance, the medical expertise, the instruction, the recommendation that is necessary to take care of the health of our community, not the health necessarily of any one of us as an individual. That's what our doctors do, but rather the combined health of the community. To do that, they are empowered by state law with many unique authorities. And so historically, where you might see the public health authority role would be in those areas where you might have a small tuberculosis outbreak and it's necessary to provide treatment and isolation and quarantine to prevent a very active disease from spreading. You saw it in the avian flu. Saw it on a smaller level, certainly, but you saw that. In the case of what's been going on here in Lubbock since March, Dr. Cook has provided that medical skill that was necessary to help us address the nursing home outbreaks. To do that, the state law empowers that health authority with the unique ability to enter what we call orders. And those orders have to be very targeted, they have to be very specific, but most importantly, they have to be on how to take care of the health of the community at large. Dr. Cook, working in conjunction with Catherine Wells, our public health director, have been doing that on our behalf nonstop since March. So you've all seen cases to where we put something out in the press. You saw where a local restaurant put us in a position that we had to close them. That authority to do that closure rests in your public health authority, not in your police department, your fire department, your fire marshals, et cetera. It's the public health authority. You saw that there were early measures put in place to try to get ahead of what was going on in nursing homes. That was all done on the authority of your local public health Authority. Certainly, city staff goes to help make it happen. We can't do that. We don't know what to do without the Public Health Authority. That's Dr. Ron Cook. He's here to speak today. Mayor, Council, just want you to know what a phenomenal job he's been doing for all of us now for quite some time. So, Dr. Cook?
Thank you. I appreciate the opportunity to speak with you. And because I believe in face masks, but face masks are there as a barrier to stop the spread of this virus. This virus goes no further, typically, than 6 feet. So I don't need a face mask or facial covering if I'm 6 feet away from somebody that's sick. There's spatial distancing, social distancing, or spatial distancing. Right now, it's 50% of the occupancy by the fire code or the fire marshal. So in this particular setting, I don't need to be any closer, and I don't need to wear facial covering. It's a mild inconvenience if you cannot do those sorts of things. We know, truly, that this virus is more infectious than the flu. Typically, less than 1% of the people die from the flu. Right now, somewhere 3 to 4% of the people that get SARS or this COVID virus will die. We've had deaths in Lubbock. And I predict there will be more deaths in Lubbock if we don't stop this virus. We don't have a vaccine. We don't have drugs. We have drugs that help mitigate, slow down, give the body a chance to heal, maybe shorten the disease by a day, maybe 2 days, maybe increase your survivability by a small percentage, but we really have no drug. And we don't have herd immunity. Some people talk about herd immunity. We have some innate herd immunity, and you heard me talk about this earlier this week on the press conference. Herd immunity is where enough people are immune to the disease because they have immunity. Then if an infected person gets in the middle of them, it doesn't go any further. It doesn't have anybody else to infect. And in this case, none of us have immunity. In fact, they just did a study in Sweden that said, wow, where they didn't, everybody got sick, a lot of people got sick, I won't say everybody, a lot of people got sick, but only less than 6%, about 6% of the people that were infected had herd immunity. You've got to get to somewhere between 70 and 90% of immunity before you get herd immunity. Flu virus has been around long enough, we've given the vaccine long enough, we have herd immunity. So the only thing that we have are physical barriers to prevent this disease. And preventing this disease means social distancing, means disinfection. The solution to pollution is dilution. You got to wash it down the drain. You got to kill it with hand sanitizer, frequent cleaning, and wearing facial covering. There are studies that show you try to blow out a candle with a facial covering that you have at your setting. You can't blow out a candle. You can't spread the virus if you're wearing a facial covering. And if you have more than 6 feet, that significantly, those respiratory droplets, as Dr. Hill said, don't travel very far. And they fall off and fall to the floor. And you can't spread it. So as long as we have social distancing, facial covering, and hand sanitation or disinfection, we're going to do fine. And when you go to restaurants and when you go to bars and when you go to other places, the grocery store, and if you're not doing your social distancing and wearing your facial covering, you're very likely to catch this virus. And as Dr. Hill said, some people are going to do very well. However, some people will not do very well. And perhaps if you catch it and you don't do very well, if you are to survive, you may have permanent lung damage. We'll see. We just don't know enough about this virus. Let me thank the alert team, Council Massengill, for your work on that, and the whole council members here, and everybody that's been involved. The healthcare industry, I'm on the front line. My other job is chairman of family medicine at the medical school. I've been practicing medicine for over 25 years, and I've been in Lubbock since 1981. I care about the citizens of Lubbock. I transferred here from Odessa to go to college here. This is my home. This is what I consider my adult home. I care about the citizens, and I want to do the best thing possible to make our citizens safe and healthy and get back to work. And the only way that we can continue to open up is by physical distancing and physical measures to stop this virus, because that's all that we have. That's all that we have. We have no other thing to stop this virus. I'm happy to answer questions. I am a proponent of wearing some kind of facial covering. And as long as you're more than 6 feet away from somebody, you're going to be just fine. And wear a facial covering.
Thank you, Dr. Cook.
My pleasure.
Okay, any questions for Dr. Cook? Mr. Griffith? I'm sorry, Mr. Griffith, then we'll go to Mr. Christian.
Thank you, Mayor. Dr. Cook, thank you so much for what you do for us. Will you speak, as we've increased, as Mr. Atkinson spoke about earlier, the last 10 days, the increases that we've had, can you speak to how many as far as hospitalization rate? Has that moved at all?
I think Jared can pull up our hospital numbers for us over time. It is increased significantly. Now, this group, as you can go back and look on the city's website, which is a great website for you to look at and look at numbers, the majority of the patients involved or patients sick right now are the 18 to 29 age group. Those, for the most part, are going to do very, very well with this infection. So they're probably not going to be hospitals. No absolutes in medicine, but probably not, and they're going to do well. However, they're going to take it, and we know that people can be asymptomatic carriers. Up to 2 days before you even show symptoms, you're shedding virus that's infectious to somebody else. And so if you go around another loved one that's in our vulnerable patient population, either age or disease or comorbidity or whatever, and they get around those individuals, they may not fare as well, and then they may end up in the hospital. And we can see those numbers on the hospital setting. They've increased. Our ICU and floor status patients have increased over the last number of
I think Mr. Atkinson may have just gotten those numbers for today. Mr. Atkinson?
Certainly, Mayor.
Mr. Atkinson, do you have those numbers? I'm sorry.
Thank you, Mayor. Yes, sir. We also have the historic chart that's on the click share as well. Today's numbers will be 37. Today's numbers will post and will be 37. Obviously, they're not on this chart. The charts will publish later tonight. 37 will be the new high. So if you go back and you start looking through April on this chart, you see where when we were up in the mid-30s, we had concern. Your local hospitals worked on their surge plans. And we never ran out. We rather watched very carefully to see what came next. So you see that we're back. We're back at the 35 as of yesterday, and we will report 37 later today.
I might add that, just as a reminder, that we serve a big geographic area, and we get some breakdown about where those patients are from. Many of those are not from Lubbock County. It doesn't change the impact it has on the hospitals. I think it's just a good piece of information to have.
And we're fortunate. Our hospitals have surge plans. I've talked to both CMOs at Covenant and University Medical Center. And we've talked to our other facilities that can help us house patients if necessary. We're not in dire straits yet. We don't need to get there. Because if you get sick, I'm sure you want a hospital bed. If I get sick, I want a hospital bed, because I trust my colleagues to take care of me. And we have excellent hospital physicians in our community. But I got to have a bed to get treated. And we don't want to run out of beds. And that's what's happened in some of our other communities. And I think it's my interpretation that's why the governor didn't stop elective surgeries in Lubbock, as he announced yesterday, is because we have hospital capacity. But when we get to when we start getting full, we're going to have to stop some of those other problems, other procedures, rather.
Thank you.
My pleasure.
Mr. Christian?
Thank you, Mr. Mayor. That's really kind of part of the question that I was going to ask, because I'm sometimes confused about the hospital capacity in regards to being able to care for COVID patients. But I know, what was the general average census, if you could even do a guesstimate of what the average census was for our hospitals prior to COVID and what they are now? And when do we reach that stress level as far as not having enough beds? Because I know some of those beds have to be set aside for other patients besides COVID. So what's that calculation of how do you figure out, how do you make sure you have enough beds for COVIDs, but how do you make sure you have enough beds for people that non-COVID patients too? Where's that trigger point, if you will?
I don't know exactly where the trigger point is. Each hospital has the ability to, each hospital has multiple ICUs. Now, some of them are dedicated to cardiac ICU and neuro ICU and pediatric ICU. And we saw where in Houston, they're moving some adult patients to pediatric hospitals because they need the space. But our hospitals here have multiple ICUs. Some of them are not as full as the other, but any of those can handle an ICU patient regardless of what their disease process is. So what you would do in most of those cases is dedicate an area, one of the ICUs or two of the ICUs, for just COVID patients, because those require special treatment and full protective equipment and that sort of thing, and we don't want to waste those sorts of things. And so those ICUs are set up only to handle COVID patients, and then otherwise medical ICU patients or cardiac patients. So we would put a normal pneumonia patient that needs to be in the ICU and monitored, that's not COVID, we would probably move them to the cardiac ICU or even the surgical ICU if necessary, so we could put more patients in a localized area. And both hospitals have that kind of surge plan. To get to that number, it's hard to say. I've asked them to let me know when they get nervous, and I touch base with them fairly frequently. And so they have my number and I have their number, so. But we're not there yet. But this trend that you see up here, if we go back to the 6th of June, that was pretty low. And all of a sudden, we've certainly increased. Now that's hospitalized patients, and it's about probably 50-50 on the floor and in the ICU. Maybe a little less in the ICU right now. But it does hit, and it typically hits. So the respiratory compromise, when you start getting short of breath, you're day 8 into your infection. Day 8 is when we see most people take the nosedive and go downhill and end up in the hospital.
Anything else, Mr. Christian? Thank you, Dr. Cook.
My pleasure.
Excuse me, I'm sorry. Mr. Chavez has a question. I'm so sorry.
Thank you, Mayor. Dr. Cook, I was looking at some numbers here, and I'm looking at the Hispanic community at 555, white 521, unknown at 367. Not to put in more value on any segment of the community, I need to clarify that, but is there a common denominator as to why the numbers are so skewed on the 555 on the Hispanics? They're so high compared to the population of the city. Has anybody looked into it or an opinion?
No, some of that depends on how they report the demographics, if they fill it out on the form when they go through the testing. And or it could be that those are in the workforces and those were in the places where those individuals were exposed initially. And so they were in that type of workforce. That's the only thing I can.
Okay.
So a lot of those were in some of the most recent ones are in restaurants and that's
in the service industry, would it be fair assessment?
Fair, yeah, very fair.
Okay. Thank you. Thank you, Mayor.
My pleasure.
Thank you, Mr. Chavez. Okay, Dr. Cook, thank you very much. Okay, counsel, after hearing from the alert recommendation and after conferring with Dr. Cook and Catherine Wells, runs our health department, and considering, I think, the facts you've seen this afternoon, the case spike bothers me, the fact that it's doubled in 11 days. Remember, we've been at this since our first case, I believe, was on March 17th. I know it was the week of Monday, March the 16th. So in 11 days, we've doubled what it took us, 100 days to get to. It's doubled in 11 days. That really, we've continued to test much more. So that's not really as big a concern for me as the positivity rate. Our rate, in other words, the rate of positive tests per 100, our rate had been between 3.5% and 4% for, well, it kept going down. It had been in that range for a 30-day time period, roughly, just off my memory. That positivity rate's nearly tripled over the last 10 days. It's north of 10%. I've been a big proponent of the fact that citizens are smart enough to do this themselves, and it was only after a couple of phone calls yesterday with some folks who really encouraged me to change my thinking, and from a standpoint of that the face coverings were the best weapon that we had, so to speak, in our quiver right now to slow this spread down. I'm not concerned about the hospital capacity. However, I would admit that it surprised me how much we've seen it change in the last week. And our hospitals are important to us for a lot of reasons. One, we count on them to be ready when we need them. We count on them to treat people that are going through this virus. And we also count on them to employ, between the two big hospitals, about 10,000 people. By the time you run that out into the businesses that support them, it's something well more than that. And so from two perspectives, they're important. They're important to that person who needs that surgery done. And they're also important because they allow those hospitals to stay open and to employ people, not only take care of people, but to employ people. A mask order, much like closing bars, will not have an overnight impact. We can trace the spike we're dealing with to Memorial Day and the days right after Memorial Day. We can trace them to the reopening of bars, and frankly, in our community, we can trace a lot of our spread to a couple hot spots. So this is not going to change things tomorrow, but I do believe it's the best course. So with that in mind, Council, I've provided you a draft. It's marked draft in red on the first page of an 11th declaration of disaster that I'm prepared to make this afternoon. And I'm going to ask for a couple of things. I'm going to ask for your input on one item in particular. And then after that, I'm going to ask that you would consider continuing and affirming this declaration. I'm going to let the city manager run through this with us at a high level. Most of the first several pages are identical to where we are today. But Mr. Atkinson, if you would do that, please, I would appreciate it.
Thank you, Mayor, council members. If you have your draft before you, we can go ahead and skip right over to page 4. Page 4. So the operative change begins with paragraph 16. There are two paragraph 16. The first states that a commercial entity in the city of Lubbock providing goods or services directly to the public must develop and implement a health and safety policy. The policy must require, at a minimum, it can go beyond, must require at a minimum all employees wear face coverings when in an area or performing an activity which will necessarily involve close contact or proximity to coworkers or the public where 6 feet of separation is not possible. So matching exactly what you heard from Dr. Cook. Immediately underneath that, the entity may develop and implement its own health and safety policy, but if instead they choose to adopt and to implement Lubbock Safe guidelines applicable to their business, including the required face coverings for employees, that will satisfy the requirement. They don't then have to do their own. They may, they're welcome to. You can take the Lubbock Safe guidelines that are already written with simply the addition of the mask, the face covering, and you've satisfied that requirement. The third paragraph under 16 says that this policy may also include the implementation of other mitigating measures, such as temperature checks or health screenings. May. It says that commercial entities must post this in a conspicuous location sufficient to provide notice to the employees and the visitors of such requirements. And then again, consistent with the governor's order, no civil or criminal penalty will be imposed on individuals for failure to wear a face covering. That's it. That's number 16. The difference then in your second 16.
So council, we're going to refer to these as 16A and 16B, okay? So just, and we'll go, I want him to go through both of these and then we'll have questions around them because I think there will be questions. So if you
Yes, sir.
contrast the differences in 16B, please.
Your document should be highlighted and shows the only difference. The only difference is A applies to employees. B applies to employees and visitors. The remainder of those two sections, section A and B, are the same. A applies only to employee. B applies to employee and visitor. Mayor, I'll stop.
Mr. Atkinson, there's another part of this that I'd like you to point to real quick before we have discussion, and it has to do with the implication to the businesses from standpoint of any fining or something like that. That's not in 16, right?
That is correct. As drafted, there's not a penalty assigned either to a business or to an individual. There's not the potential of a penalty. Let me state that more correctly. There's not the potential for a penalty to the business or the individual as drafted.
I think that gets to what Mr. Christian was talking about a few minutes ago. I want to make sure. Okay, let's go to the Mayor Pro Tem. I think he had a question. Are you good? Okay. So council, what I'm asking your input on, do you prefer, A, or do you prefer we go all the way and go ahead and require both employees and visitors? This is not somebody walking down the street. This is once they enter a commercial entity.
Correct.
This doesn't apply to your churches. Texas Tech's rules, they have their own set of rules. School districts, schools have their own rules. Okay?
County, state, and federal properties.
County, state, and federal, but these are commercial entities in our community. Mr. Massengill.
I'll start, Mayor. Thank you. As much as I've always disliked putting any requirement on a business, understanding the seriousness of this, and I have to ask myself which of our two choices here is most effective, I have to support 16B, Mayor. That includes employees and visitors.
Thank you, Mr. Massengill. So if you're going to take a bite at the apple, we want to go and take the full bite. That's what you're saying?
Seems to me that it would be the quickest path to get back to a point, whenever that might be, where we might not be able to have to require facial coverings.
Thank you, Mr. Masco. Mr. Griffith, you operate a retail establishment. Your people have worn masks since the very beginning of this. You also cover a large region, so not all your folks come from Lubbock. Not all your clients do. I mean, so what's your take on this? You and I have not discussed this. I mean, we haven't discussed this order. We've talked a lot about your clientele and things you've shared with me over the last 90 days or so. What's your take on this?
It is, in my personal case, my particular business.
Mike's not on.
It is now.
Thank you.
There, it should be on now. There you go.
In my particular business, and yes, we have clients from all over West Texas and eastern New Mexico, and it is interesting because day one, yes, we have required all staff to wear facial coverings. The part about visitors into the business, it's amazing how many people voluntarily bring their own facial coverings. And people call the business and say, am I required to wear one if I come to your store? We say, no, we recommend it, but you're not required to. I would say that over 50% of the people who come to my business are voluntarily wearing them. The folks that are not, I don't have an issue with at all. I differ with Mr. Massengale. I believe that A is my recommendation because I do think it's personal responsibility. I do believe that folks, you know, it's kind of hard enough for me to sit here and think that basically we're taking an action that we really don't have real enforcement on. However, understanding the seriousness from our medical professionals of where we're at, but I do believe A is my option, my recommendation. I think that stores need to handle their business properly, retail or service industry, office businesses. I do think that it is a business's responsibility to keep their people safe and keep their clients safe.
Thank you, Mr. Griffith. Mr. Chattis.
Thank you, Mayor. I also would, in favor of 6B, but a question on 6B. Says all employees and visitors to wear face covering. So is it up to the business person when the individual walks in to say, you will wear a mask or a face cover?
Yes.
I mean, are we putting a responsibility on the business, I guess is the question.
Yes, you are. The business is required to post the signage, and the signage will be up front and noted. But yes.
Okay, John Q. Public walks into a business. Business says you can't come in if you're not wearing a mask or a face cover. Now it's up to the individual to either walk in that door or take his business elsewhere.
That's correct.
Correct? Mm-hmm. So he or that person gets to vote with their paycheck or with their check if they're going to do business there or not. We're not, I guess where I'm going with this, we're not imposing, we're not mandating that John Q. Public must wear face cover. Again.
And we've not finished going through the order. There is not a global requirement for masks.
But at this
so
point,
there are other specific cases, large gatherings such
to be
as
discussed
that.
later. But at this point, the business owner has the right to decide, as Mr. Griffith just said. We recommend, or are they recommending or are they mandating?
The business is requiring.
Okay. We just want to make sure that the business people understand this is where we're going. So the responsibility is on the business owner at this point, or the business itself at this point.
Correct.
Okay, just wanted to clarify. Thank you, Mayor.
Just to add to that, Mr. Chavez, a business owner today could require someone to wear a mask.
No, definitely,
Yeah,
understood.
that's a little bit like no shoes, no shirt, no service type thing. That's an option they have today.
And I'm all in favor of that. You know, I think the numbers are way, way too large. And I like the fact that we're being very aggressive now addressing this issue that's affecting the population of Lubbock. You know, we're making a statement, we're making a strong stand on this. And I'm all in favor, and whatever we can do to help the public. And I think the statement was made earlier about legislating. Well, we are the legislative branch of city government, FYI. We do have that right. I just want to make sure that when we do make it, everybody's aware as to what decision we're making, because it does affect the public. It affects me. I'm the target audience. You know, Mr. Christian, you know, we're immunocompromised. So I want to make sure that when I walk out in the public, that, you know, we're not stepping on your toes because we're asking you to wear facial covering. But if your right to not wear facial covering is exposing me and my family and my beloved ones to something that I have no control over. So I say yes, you should. I wish we could enforce it even stronger than that. But for legal reasons, we cannot. And I understand that. But I can't emphasize how strong I feel about facial covering.
Thank you, Mr. Chavez. Ms. Joy, I'm interested in your thoughts.
Yes. Before I go to 16, I have a question about paragraph 25. Because I don't know what section, I don't have it in front of me, 418.173 says. 25 actually has a punishment provision in it.
Mayor, I'll be
Please,
glad to
Mr.
speak to
Mr.
that.
Atkinson.
Thank you, ma'am. You're correct. I had in an earlier note that we needed to put an exemption in there as it related to number 16, and it's not in the draft. That's my fault for not catching that.
That's what I was looking for earlier, so, okay.
No, you're right. We had discussed that, Mayor. And
Yes.
I did not get it included. I think it'll be a simple draft when you final this document to do that.
So we would strike 25?
No, I wouldn't suggest striking it in its entirety. I would rather suggest, and this will be subject to Mr. Weaver and his team, but you're excluding these facial covering requirement sections from it. There are other things in here that speak to public health authority and other items that we need to keep it.
Okay. Mr. Weaver, why don't you think about some language around that while we go back to 16 for a minute, and I'll come back to you, okay? Ms.
Okay, and on 16, we need to, when you're looking at A, for example, and I'm going back to the task force meeting that we had, and kind of how we address that. If you go down to the end of that paragraph, that all employees and business wear face coverings when in an area or performing an activity which will necessarily involve close contact or proximity to coworkers or the public where 6 feet of separation is not feasible. So, to me, that says you don't have to wear a covering if that business owner has done social distancing and is not allowing anyone to violate that. Am I wrong about that? But I think that was a serious consideration at the task force meeting.
Mr. Atkinson.
Thank you, Mayor. Council member, you are correct. In addition, a little farther into your document, it's paragraph 20. And this applies to everything relating to the facial coverings in your order. The requirement only applies when in an area or performing an activity which will necessarily involve close contact or proximity to other people where at least 6 feet of separation is not feasible. So if you're in the example I believe I heard on the phone and you don't have that contact, they do not have to wear the coverings.
And I guess all I'm saying is that there's some flexibility for businesses. I have some issues with putting this responsibility on the business owner. I'm not sure that's equitable, but as long as we have this language that we discussed in the task force meeting, then I can agree, and we make this other change about penalties, I can do 6A, or 16A, sorry,
Say that again. You can do what? I'm sorry?
16A.
Okay. So it would just be on employees.
Well, no, I thought that's the one with visitors.
That's B.
No, that's employees and visitors.
Okay, that's B. That's what I thought you were getting towards, but you said A. Okay.
Oh, okay, sorry.
That's all right. That's okay. Okay, let's, Mr. Christian, you have anything to add in on this?
Well, I just thought I'd give you my up or down on A and B.
Please.
As much as I would like to say I'm all for B, a lot of our businesses in town are already pretty stressed out. And I would hate to put another duty on them, if you will, is to make sure that every visitor that comes into their place of work, place of business, has a mask. In my opinion, A still would allow them to do just that as they're doing right now. If a business decides that they want their visitors to wear a mask, they could post that, if I'm not mistaken, isn't that correct? They could do that on their own. So what Mr. Chavez was saying is if people, kind of deciding with their pocketbook on businesses, there's some folks that may rather do their business with a business that has a posting that says all visitors will wear a mask, as far as the safety and security of that individual that may or may not shop or dine or whatever at a business. So I tend to go with A, just because it gives some more flexibility for that business to decide whether they're going to implement and require a mask to be worn in their place of business. Because like I said, I think there's some people that might welcome doing business with that business. It's taking that added step for safety for their employees and their customers. Thank you, Mr. Mayor.
Thank you, Mr. Christian. Let's go through the rest of the order. We'll come back to 16 at the very end. I'll make a few comments at that point, but I think it's important that we get Mr. Atkinson point out sort of the key points of this. If you continue, please, Jarrett.
There we go. Okay, we'll go to 17. This is coming out of Governor Abbott's order. So we've already talked about it. Outdoor gathering, estimated to be in excess of 100 people, other than those exempted by the governor, is prohibited unless approved by the mayor. Such approval can be made subject to conditions or restrictions that are not inconsistent with the governor's order. So that's picking the language up and carrying it over. Now, we go to number 18. And other than exceptions provided in the executive order of the governor, individuals at outdoor events where social distancing is not feasible and the 100 people or more are present are required to wear face coverings. So now, keep in mind, please, council, this is an event that other than approval granted through the mayor's office is prohibited by the governor. So the permissive to allow these events to occur reside in the authority here. Number 20, we touched on this briefly. I want to read the second half of it. I didn't get the first half. So on number 20.
Don't miss 19.
Oh, yes, sir. My mistake. So number 19.
This, by the way, this is Mr. Atkinson's call in his purview as city manager, but we're going to, this is what he is requested that I add to this order. So if you'd run through this, I'd appreciate it.
Absolutely correct, Mayor. This will be of great assistance as we try to make available our public facilities. Individuals that visit city facilities or events held at city facilities are required to wear face coverings. This applies equally to our employees, to our volunteers, as well as to visitors at our facilities and events. Okay? I think it's going to be very important. Now, 19, 18, 17, 16, all these requirements that ultimately relate to face coverings have a catch-all in number 20. The requirement applies only when you're in an area or you're doing something that involves close contact or proximity where you don't have your 6 feet of separation. So when we were working our way through this earlier today, I want to jog in the park. I wish to ride my mountain bike. I wish only in my family unit to be at the playground together. No, you don't have to wear a mask. You don't. You're at the business. We're going to get into the next part. This also does not apply if covering the nose and the mouth poses a significant mental or physical health risk to the individual. There are certain accommodations that absolutely need to be made, and they will. This does not apply when wearing a face covering is impractical due to your immediate circumstance. I'm eating. I'm having something to drink. I'm at a dental office. Okay? So I think there's a good dose of accommodation and realism in here, and there needs to be. That's contained in number 20. Number 21, I think we need a little definition. What's a face covering, a face mask, etc.? We say so. It is a homemade mask, a scarf, a bandana, or a handkerchief. It can be a manufactured mask. Unfortunately, and I know everybody in the room has seen this at least once, we're going to have to say, I believe, that it's not really a face covering if you don't at the same time cover your nose and your mouth. Your nose and your mouth. So, Mayor, with that, that carries you through the changes, and I'll take questions if you have any.
Let's go ahead while we're at it and go down on enforcement. On Mr. Weaver, are you ready? Do you have some language for us?
I do.
Okay. Or suggestion how we might change this, I should say.
Well, I do have some changes. The
Okay.
way we have styled this, it's kind of all-encompassing on whether you decide 16B or 16A.
Okay.
So if you are willing to wait, I can give it to you all at once, and you
Okay.
can do it all at once, or if
Okay.
you prefer, I can
Okay.
break it up, but it's up to you, sir.
Yeah, I'll go ahead and weigh in on go ahead and make a call on 16A or B. I'm going to go with 16A. As much as I'd like to take the full bite at the apple, I tend to agree that putting it on the businesses, there's enough on our businesses, and I just don't, I don't think that's the right thing to do. I also think it would make it clear for the case of our staff and the phone calls that will come here and to LPD and to the fire marshal's office. And so we're going to go with, that'll be my order. Okay, then on paragraph 25, so we will strike 16B, council. And on paragraph 25, it's amended to include this penalty provision is not applicable to any provision requiring the wearing of a face mask, or face covering, face covering. Once again, paragraph 25 will be amended to include, quote, this penalty provision is not applicable to any provision requiring the wearing of a face covering, end quote. Council, is there any further discussion before I declare this 11th? Mr. Chattis, do you have a comment?
Comment, question?
Sure.
Okay, we're going with 16B?
16A.
16A, based on?
Excuse me?
How was that decision
Just because
made?
I think that I don't think businesses should have the burden of having to go tell people to wear their face covering. I think we're asking that to be done, but I know of a situation in a Metroplex grocery store this week where the city had put a face covering order in place, much like we're proposing, without penalties, much like we're proposing. And I talked to an operator who, had to deal with a situation where 7 folks walked in to flaunt the fact, made it very public that they weren't wearing their face coverings. And I just think our businesses have been through a very rough 110 days, 100 days, whatever it may be. And I just feel like let's declare the mask. Let's require them to put their employees in that. I think the vast majority of our citizens will go along with that. And that's my reasoning on that. I also don't want to put the burden on a business to have to go provide PPE.
Yeah.
And it's available, but that doesn't mean it's cheap. And a lot of our businesses, there's not a line item in there for something like that.
I understand the rationale. I don't necessarily agree with it.
I understand completely.
Because we're leaving that decision up to the public, and the public's already shown what their decision is. That's why our numbers are so high. I understand we can't enforce it legally. I understand that perfectly well. I'm a team player, but I think we need to continue pounding the message to the public how important it is to have facial covering. We need to continue doing that. Thank you, Mayor.
I agree. I appreciate your input and your opinion. Our order will continue to talk about the importance of facial covering, as does the governor's order. And, we've got to continue to drive that home. But that's where my head is. Ms. Joy.
This may be a question for legal. Is it necessary for the council to affirm your order? My understanding was once you order it, it's good.
Only for a period of time.
The reason, Ms. Joy, that I'm asking you guys to continue and affirm it today is I believe that order has a 7-day life, and the council would then have, sometime in a 7-day period, would have to come in and consider continuing and affirming. So that was the thought process on that, on item, posting for item 4. Mr. Weaver.
It's been discussed that might be a help. The face covering aspect of this is only going to be good, if you look at paragraph 28, it's only good through July 28th, which I believe is the second meeting in July, is it?
That's correct.
Jared?
That's correct.
So at that meeting, the council could revisit this and have any discussion they feel is appropriate, but I didn't recall that had been discussed, and I was a little distracted at one point with my staff, but that may be a factor that is relevant. I just wanted to point it out.
It's a very good point. I don't believe we talked about it. Yes, sir.
In that same paragraph, and we didn't point this out either, action today is effective Monday. Action today, the way this is written, is effective Monday.
Okay. So, council, with the changes, yes, ma'am, Ms. Joy.
There is enough flexibility
I agree with you, I completely agree with you, Ms. Joy, but I've sat in my office for 110 days and listened to the phone ring and the questions that we're having to answer for people that if they read what we had said, they probably could understand it. Probably. Some of this is confusing, but our phone, after the governor's order this morning, our phone has rung all day long with us, people wanting us to change that, which we can't. And I just want to make this easy for our, and it's not just businesses, it's anybody that it's a nonprofit that operates, that has people coming in and out of their location. This is not I'm not driving a stake in the ground on a pro-business stance here, as more as I'm trying to make it, to relieve them having to enforce something that's unenforceable. As exciting as that may seem. Mr. Massengill.
I want to make one point to Mr. Chavez's communication piece, and this was discussed in our task force meeting, is the task force felt like, regardless of how disabled we are on the enforcement, which by the way is by virtue of the governor's order, just so everyone understands, is the mayor's emergency declaration, this order is just as effective as a communication piece as anything else, to understand the importance of this. So, thank you.
Anything else, council? Okay, so I with the following changes, striking 16B and adding the language on 25 that says this penalty provision is not applicable to any provision requiring the wearing of a face covering, I am now issuing the 11th declaration of disaster. I'd like City Secretary and legal staff to prepare that document in that final form for signature, please. We'll move now to item 4 on our agenda. Item 4 is to consider a resolution continuing and affirming the mayor's declaration of disaster regarding COVID-19 pandemic, and to include a declaration regarding large gatherings and requirements for face coverings. It's what we just considered. After 7 days, the city charter, I believe it's the charter, it's not state law, right? It's state law. After 7 days, the mayor's order would expire without the council's affirming of the order. I'll open the floor for a motion on item 4.
Move to approve.
Thank you, Mr. Massengill. Thank you, Mr. Christian. Discussion.
Mr. Mayor,
Yes, ma'am.
there will be some people who think we haven't made any change, but your declaration would be a change. We do not have an order requiring employees to wear masks. Mr. Maxwell is correct. With not having an enforceability piece, it does limit us, and since the governor won't allow that, then we'll just have to live with your declaration until July 28th. And maybe at that point in time, we can see some changes, or at least recognize that people are doing a better job of being responsible and wearing their masks.
I think you made a really good point. I think we know that today we have personal services businesses, So people that are right in someone's face providing services that are choosing not to wear a mask. We have bars and restaurants, people serving our food that are choosing not to wear a mask. This order requires that. The enforcement side is difficult, but it requires that, and it sends a message to our citizens that that's what they should be looking for when they go into these establishments. For all the reasons we talked about before, I believe it's the logical next step. Mr. Griffith.
Oh, no, I didn't have a comment.
Okay.
I'm sorry. I thought
That's quite okay.
We were taking, we have a motion and a second.
We do have a motion and a second. I don't want to stifle any discussion if there's further discussion. Mr. Chavez, do you have discussion?
Yes, sir. I'm still a little bit, we as a city can tell people when they walk in City Hall, you have to wear facial covering or refuse them entrance. Is that correct? That's on number 19?
That's correct. Those are our customers that come in here, and we have the ability to do that per the governor's order.
It seems like 16B does the same thing.
16B would for the universe of your businesses
Right.
in Lubbock.
It's the same message. If we're doing it at City Hall, but yet they can't, we're telling the businesses that they can, but they don't have our support if they do it.
You're not requiring
Right.
a business to do that.
But the business does have the right to do it
Absolutely.
without our support.
Without your requirement. We may be saying the same thing, but
Same
yes.
thing. Yes, sir.
Our order and the governor's order give them the ability to do that.
Of course,
Clearly.
they've always had.
They have had that ability.
Yes.
That's correct.
I just need to voice my concern.
I understand.
Thank you.
Other thoughts, comments? Okay, we've got a motion on the table to approve the resolution that is item 4, continuing and affirming the declaration of disaster. All those in favor of that motion, please say aye. Aye. And opposed by the same sign? I think the motion carries 5-1. I believe that's right. Ms. Joy, is that correct?
Yes, because, and I'll just explain, this is just a formality in order to avoid the 7-day expiration. It doesn't necessarily mean, Mr. Titus, that we agree.
Thank you. Just want to make sure I wasn't certain I heard your vote. I want to make sure I get it captured correctly. Okay. That's all the business that's in front of us today. I have already asked Mr. Massengale to assemble alert or whichever subcommittee of alert immediately to update the Lubbock Safe guidelines so they're consistent with our order. I'm thankful for the cooperation and support of the efforts that we are making to protect our community. The vast majority of our citizens, I believe, just based upon the feedback I get, are supportive of that. We all would like more information. We all look forward to a day that we can safely and sensibly return to living a life differently than we are today. I think that's what we all look forward to. So I'm thankful, council, for each of you. I'm thankful for staff pivoting so quickly to have a special meeting on a Friday afternoon. It is 4:52. The Lubbock City Council is adjourned.